Then these are the four stages of risk management. First one is risk identification. Second one is risk analysis. Third one is risk control, and fourth is risk monitoring. So the first one is risk identification. It is the first step of risk management. So we know that no steps can be taken in the risk management if the risk has not been identified. Risk identification begins with the initiation uh, of a problem start. When the problem is starting, then we are identifying there is a problem. So it can either be objective based, or it is scenario based, or a taxonomy based, and common risk checking. And the second one is risk analysis. Risk analysis. The process involves analysis of risk, estimating the first analyze the first identification, then analyzing. In here, these steps we are taking, estimating the vulnerability and its effects, how it's vulnerable, then the frequency, and how it's severe. How severity of risk will also be assessed in here. And the third one is risk controlling. After the analysis comes controlling of risk. It consists of procedures, systems, policies that an organization requires to manage the possible risks. Then the fourth is, and the last step is uh, risk monitoring. Risk monitoring should be done in order to achieve the expected result of a risk management process. We are expecting this is our result. So the monitoring should be done to check whether the outcome are achieved or not. If not, then checking the problem, we can do anything. So these are the four steps of risk management. Then we are looking the risk management strategy framework. Here I mentioned the determining priorities of risk, then identification of risk, then evaluation of risk, responding to risk, reporting risk, and reviewing risk. Before that, I have to add on something. The New Zealand has improved health and living longer than it was 150 years ago. But the infectious diseases are still eminent in New Zealand. In case of reports of deaths and significant illness, New Zealand had adopted new health strategy to manage the infection and its risk. The IAID addresses the goal of providing a better health conditions, its suitable health care services, and creating harmful infection-free environment for the people. Every time New Zealand is looking like pollution-free, or not being affected to human being or people, because every time they are reducing or maximum eradicating, they are trying to eradicate the risk. The IAID had taken several initiatives, especially strategies for child and the youth health. It has launched several social media as well as online campaigns, which all infection related to dengue, malaria, Zika viruses can be mitigated. Uh, Moreover, a national mosquito surveillance program has been operating in New Zealand for several years to track down the level of Zika virus. and the IAID should take uh, more initiative to educate the people of New Zealand to fight against the diseases. The government of New Zealand had taken the initiative to allocate a sufficient amount of money to improve the health of the people. That's not a small thing, because government are government are concerned about the health of the New Zealand government is concerned about the health of people, so they are allocating sufficient amount of money to improve the health of the people through implementation of World Mosquito Program with the fund about New Zealand dollar 2.7 million has helped to reduce the burden of dengue. And it include benefits like education, environmental education, social welfare benefits, and housing. In some houses, there is a no insulation, or if winter is coming, there is no heater provided. So the moisture is another another thing of getting an infection, especially in childs and uh, rest of the people. Here I describe the determining each and every steps, determining priorities of risk. Here, management teams need to be clear regarding each objectives and the services they need to provide to manage or treat a risk. That is very important, and this is the critical activity for both strategic and operational level, which can be included the portable sources of risk. This is the evaluation of risk, and here I mentioned the evaluation of risk is done separate minor and major risk. Here, almost likely, possible, unlikely, and rare. Some cases insignificant in low cases, and minor, medium, high, and extreme. This is the evaluation of risk, and this is responding to risk. Responding to risk is another important step. Avoid. No action is performed for avoiding gain of outcome of an outbreak. Then mitigate, then transferring the risk, then accepting the risk. And reporting. These are the reporting chart. Risk score. It's mentioned like a color. Immediate responses needed. Proper action plan required. Monitoring required. Management routine processes. Then what are the benefits of this? The benefits of prevention and the management outbreak, it covers the prevention from potential detection and management of the time actual outbreak. This keep us updated, the informed about the issues ways that can be faced, and on the top of it, we are already acknowledged about the disease, and we can always keep prevention method on the go to keep us safe and ready. And the benefits of risk management strategy and framework by government and IAID are that the people of New Zealand are going to be more responsible about the environment. The people being responsible to the environment will result in the decrease of harmful impacts on the climate. The people of developing country like New Zealand are need for the healthcare services and benefits to manage infectious diseases from the spreading and post being an epidemic. The initiative by the government will be help to understand the infectious disease. Now I am concluding my presentation. So in conclusion, the climate change and the infectious diseases are interdependent and linked with each other. The climate changes are the main contributors to the transmission of infectious disease, and the information collected from infectious disease is to be modeled to strategy for risk management and assessment. I conclude my